I am Dr. Tommy Wade Farrell. I'm a physician in Abilene, Texas. I do both hospice and palliative medicine work. I was one of the physicians who was an early certifier in the hospice palliative medicine field, even before the ABMS certification came about. And then I was blessed, like many of you, to become HPM certified when the ABMS certification came about. I've also had the opportunity to be involved as HPM. I decided that they needed a certification process for physicians who worked in hospice but did not have the benefit of fellowship training, and the Hospice Medical Director Certification exam was born from that. My intent is to make sure I share how this is different and what the value of this exam is compared to the Hospice Palliative Medicine exam. The Hospice Palliative Medicine exam through the ABMS board is broader. It does have hospice elements, but not all of them are specific to the scope of practice of a daily hospice physician. Things like doing certifications, supervising staff, communicating the mission of hospice, and being up to date to the knowledge of the regulations that are changing quite often. The Hospice Medical Director Certification exam is very hospice physician specific. Everyone taking the exam that has spoken to me has told me that this is really the job that they do daily. The heaviest difference they notice is that there is much more on the regulation piece than just asking questions about clinical knowledge. If you take the Hospice Medical Director Certification exam, you're expected to understand the blueprint that's found on HMDC or HMDCB.org. It includes sections such as eligibility requirements, levels of care. There's a section on patient and family care. There's a section on medical knowledge. These questions are very similar to the HPM style questions, but the scenarios are all hospice focused, whether it be outpatient hospice or inpatient hospice, rather than being palliative medicine focused. There's sections on professionalism, section on regulatory compliance and quality improvement, those specific questions on regulations that I've mentioned already, as well as medical leadership and communication that would make sure that test the areas of you being a part of the hospice team, supervising nurse practitioners, and working with external partners to the hospice field. This is not an ABMS board, so it currently does not carry the same weight as a fellowship trained board, but we are building the value throughout the industry. We are doing this by helping hospitals and organizations understand that this is the gold standard exam for showing that a physician knows how to be a hospice medical director or a hospice physician. So people are taking this exam for mainly one of two reasons. Some are doing this for personal reasons. They want to show that this is their level of expertise in this field and that they are dedicated to the hospice physician mission. They are also joining the network of now over 1,100 physicians that are certified that are creating a community within the hospice medical director certification. Others are taking this exam because their organization has asked them to consider being certified, but they did not have the opportunity to go back and become fellowship trained and take the broader HPM exam. For either reason, we hope that you'll consider taking the exam if it's right for you. I'm personally proud, having been involved from the inception of this organization, to see how much it's grown to more than just a certification exam, but to a broader community. It has the value of networking opportunities with physicians like yourself who are dedicated to the hospice mission. If you want more information, please go to hmdcb.org and learn more about the exam and the hospice physician community that we're building there. I look forward to seeing you certified or at one of our next coffee chats or webinars. Thank you.